Back, if you suffer from heartburn, you know how painful that can be. And now a new study finds patients with frequent heartburn are 78% more likely to develop cancer of the throat and vocal cords. The report finds that the same antacids that reduce the discomfort could also reduce the cancer risk. Dr. David Samadi is a member of the Fox News Medical Aid team. He's also the chief of the Division of Robotics at Mount Sinai School of Medicine. Always good to see you.
Nice to see you, Arthur.
And this is a really fascinating story because, you know, with heartburn, a lot of people suffer from reflux. So you've got all that acid coming up in the throat area, the esophagus. So it sort of makes sense that this canal, you're saying, it could bring on throat cancer.
Yeah, this is actually quite important because for years, everyone knows that heartburn could be very annoying. But is it really a major risk factor for cancers of esophagus, for throat, for vocal cord? And this particular study, which is a good one, and it's coming from American Cancer Society, tells us that heartburn and acid reflux could be an independent risk factor for all of these cancers. Nobody will debate that smoking, alcohol, and human papillomavirus, that's already established as a major risk factor for the larynx and oral cancers. And now heartburn is declaring itself as an independent risk. It's a big study.
But that's huge because a lot of people suffer from heartburn. You have a little spicy food, a little bit later you have heartburn. So how do you avoid that turning into throat cancer?
Well, that's really important because one of the major risk factors for heartburn, besides diet, which we'll talk about, is obesity. If you have a lot of weight around your belly area, that pushes the stomach, opens up, and reflux and acid can get up there. A lot of fatty foods can do this. Anything that will open up that sphincter that's supposed to block the acid from going up to the esophagus is going to be a problem. So chocolate, alcohol, fatty food, how about citrus, tomatoes, any of those can do this. So the big message to a lot of people is at nighttime, 3 hours before you go to bed, you don't want to have like a big food and just go to bed because that's going to increase your acid reflux. You got to make sure that you eat small portion. If you're obese, you want to make sure that you lose weight. The other interesting part about this study, as we mentioned, was antacid, over-the-counter medication, reduced the risk by 41%, and that's a big deal. The real prescription medications did not do it. But what is it in antacid that actually reduced the risk? We don't know yet, but that's a very interesting finding.
Circle back quickly for me. You mentioned alcohol, chocolate, spicy food, things like a lot of people like. So you're not saying, though, that if you eat that, you're definitely going to get throat cancer.
It probably causes it. No, you're absolutely right. It doesn't have to be a direct cause of it. It may increase your risk, but if you're suffering from heartburn and if you have that twice a week, your risk of cancer will go up by 78% based on this. So guess what? Avoid or a moderation of those diet is important. Don't eat a big fatty food with a lot of like wine, etc., and go straight to bed because then you're going to basically increase your risk.
And yes or no, if you have a lot of chronic heartburn, you probably should go to the doctor.
Absolutely.
Right? Okay, Dr. David Samadi, thank you very much.
Nice to see you and have a great weekend.
You do the same.
Not too much fatty food.
Boring.
You're good anyway.
Boring.
We'll try to remember that. Thank you, doctor.